Pharmacology for nurses. This is your top 6 anticoagulation and blood-borne medications. These are medication that you have to know if you're a nursing student in nursing school or you're preparing for your NCLEX. I'm picking 6 medications because they are high yield, life-threatening, frequent use in a clinical setting, side effects that your board will play with you. First one, warfarin, coumadin, everybody know, is an anticoagulation. It prevents coagulation. So anticoagulation. So when you bleed for a long time. When you catch yourself, instead of forming a clot, it prevents clot formation. So it's used as a long-term prevention of blood clot, like AFib, DVT, and pulmonary embolism. You have to teach the patient what they need to watch for. Usually your INR is like 1. So when you catch yourself, you bleed a little bit and you stop. When I put you on coumadin, it takes a long time. So it increases to 2 to 3. So the therapeutic level we want is 2 to 3. How long does it take you to clot? It can take you 16 to 27 seconds. That's a lot of time to bleed. So your PT level when you're on anticoagulation is 16 to 27 seconds. Usually, your normal PT is 11 to 13 seconds. If somebody is bleeding because they're on warfarin or coumadin, give them vitamin K because warfarin block vitamin K dependent factors to prevent you from clotting. They are used to clot, but when I give you warfarin, all those factors are destroyed. So if you're bleeding because you're taking coumadin or warfarin, you get vitamin K. What are the teaching you should provide to the patient? This is what the NCLEX will ask you. 1, bleeding precaution is a lot of things, right? Use electric shavers, right? Don't use razor blade, right? Avoid NSAID and other medication, right? If you see black tarry stool, let me know. If you are an older patient, you should take all the rags from the floor so that you don't fall and break your leg. Have a bracelet on, right? Bristol toothbrush or a bleeding precaution. Avoid sudden increase in living vegetables. The next one is the key. I changed it. I said consistent amount of vitamin K rich diet. So if you're on coumadin, don't increase how much vitamin K you take. Don't decrease how much vitamin K you take. Those are the traps they will ask you on the NCLEX or on your nursing school exams. Look for answer choice that say consistent amount of vitamin K dependent diet or vitamin K rich diet. It takes several times for it to work to become therapeutic. Therefore, the last information say need to be bridged with heparin. So usually you can see people taking warfarin with heparin because it takes a long time for warfarin to become therapeutic, while heparin can become therapeutic in a short time. So you need heparin to bridge it. This will prevent skin necrosis and the other thing. You cannot use it in pregnancy because it's teratogenic. These screen you're seeing, all the information there are testable NCLEX or nursing school information. You can give it to somebody right now. It can take care of the immediate anticoagulation. So if you need immediate anticoagulation, usually we give them heparin, right? And what is that? It can be given as IV infusion or sub-Q inject. What do? We got to monitor your PTT level, not the PT. If I give you heparin, your PTT level will go to 60 to 80 seconds. That's how long it will take you to form a clot. That's the therapeutic level, right? It's going to take a long time. So 60 to 80 seconds, when we get you there, that means we prevent you from clotting at all. Very long time. If somebody is overdose on heparin, give them Protamine Sulfate. That's the antidote. What are the key things you need to know about heparin? You don't need to change your diet. No diet restriction. You can eat anything you want. The same bleeding precaution I talk about, it has a very short half-life, like 90 minutes. So if somebody is on heparin drip and the aPTT is high, like 100, 150, you can stop it, and 90 minutes later, it will come back to the same normal range. The other thing the board will ask you is heparin-induced thrombocytopenia. Anybody you give them heparin is going to lower their platelet. If you lower your platelet by the fourth day and it decreased by 50%, that means you have heparin-induced thrombocytopenia. And what does that mean? You're more likely to form clot than bleeding. So you look for stroke, pulmonary embolism, or DVT. That is the key. That is the concept regarding heparin-induced thrombocytopenia. He give you heparin, and in 4 days later, your platelet has dropped by 50%. You have heparin-induced thrombocytopenia. I should be looking for clot problem, and you should not give them any heparin medication anymore. Next one. This is heparin. Enoxaparin is a lower molecular form of heparin, but it's the same thing as heparin. You cannot use it in a patient who has heparin-induced thrombocytopenia because it's heparin. You can use it to treat DVT-P, right, after surgery. It's a lower molecular heparin. It's given as a sub-Q. There is no IV form, so you give it as an injection, subcutaneous injection, no IV form. Usually it come in the pre-formed syringe. You don't have to break it. You don't have to do anything. Just inject it based on it. So do not expel the air bubble in the pre-filled syringe. You don't have to draw it. It's already prepared for you. You just inject it. Monitor for bleeding. Same bleeding precaution I told you. Key, you don't need to change your diet. You don't need any lab monitoring. Unlike regular heparin that need lab monitoring, when they are in the hospital and they're on IV form infusion, they need PTT. But when they're on sub-Q form, you don't need any PTT, so no lab form. Clopidogrel, Plavix. This is antiplatelet. It's not anticoagulation. They prevent platelet clot formation and they prevent bleeding, right? They causes bleeding because they prevent platelet aggregation. They going to cause bleeding. They prevent clot formation. So we use it if you have a stent or you have a heart problem and there is a stent, we'll give it to you so that you don't clot your stent. Same thing. They were going to block the platelet 7 days. Therefore, you should stop it 7 days before any surgery. And you should watch for bleeding, same bleeding precaution. Sometimes they can combine it with any other antiplatelet to prevent clot formation, thrombosis of stents. This one is key. They are anticoagulation. I call them the Zabans and the Gatrobans, but these are the two Zabans, Apixaban or Rivaroxaban. You see, they have Xaban at the end. They are anticoagulation, but they are direct inhibitors of thrombins. They're different from covidine, they're different from heparin, but they're special. They can also be used for what? DVT, PE, and AFib to ensure anticoagulation. The good thing about them, there's no lab work. You don't need to change your diet. They come with a fixed dose. You can take it by mouth. Most of them, you will take it by mouth. That is how good they are. There used to be no antidote, but now there is a reversal agent called adenosine alpha. Don't forget. So those Zabans, Apixaban, Rivaroxaban, or Dabigatran, there is a reversible agent called adenosine alpha, and these will reverse the effect. Like Coumadin and Heparin has its own antidote. This is the antidote. Adenosine alpha. You should still monitor for bleeding. And the last one is Alteplase. This is very good medication. If they give you neuro question or stroke, you should know. And I'll show you what information they're going to ask you in whether in the nursing school or NCLEX question. But this information you need to know. They are not anticoagulation, they are not antiplatelet, but they go and attack a clot and they burst the clot. So they are clot busters. So if you have a stroke or heart attack, they go to where the clot is and they break it into pieces. Because of that, they can cause massive bleeding because they break the clot and there's blood everywhere. You can only give it to a patient if they have stroke, if they come in within 4.5 hours. You can give it to somebody who has a heart problem, but MI, if they come in within 12 hours of MI. After that, there is a contraindications. You can give it to them. If you give it to them, there's no IV, no IM medication because the individual will bleed. What are the contraindications? That's what your board will ask you. That means if you see this sign, we cannot give them Alteplase. If you just had abdominal surgery within 2 weeks, you cannot get this medication. If you have head trauma, you cannot get it, this medication. If you have hemorrhagic stroke, you cannot get it. If your blood pressure is on control, we mean greater than 180 over 110, right? Anything above 180, getting to 190, 200, or diastolic over 100, that is on control. If you have had surgery within 3 months, you're not going to get it. These are contraindication to this medication. That is what your board will ask you. The AVM is atrial venous malformation. If you have it, you cannot get Alteplase. These six medications are very, very important. I want you to know them. It's going to help you for your nursing school, wherever you go, even on the boards, on your exams, on the ward doing clinicals, and those preparing for their NCLEX. Take care and good luck. If you like this series, put a comment, put down questions that you want me to answer. Subscribe to Adapt NCLEX and join our on-demand or join our membership to learn more of this. Take care of yourself and good luck.